My involvement with Mission Hospital started after I gave birth to my second child. That was in September of 2006. Had my husband with me and my son with me as well, and we all went to the doctor's appointment expecting that we were going to schedule the date of delivery, and unbeknownst to me, my daughter had no heart tones. And so she was 5 days shy of her due date, full term, stillborn, beautiful baby girl, and that is where my involvement with Mission Hospital really began, and my passion for helping other patients and other families who walk in similar circumstances to mine. I think some of the biggest lessons that we learn from life come from probably the most difficult circumstances. I think come from the outside, most people would say. I'm the same person I was then, but there's pretty much everything inside of me is different after that day. I'm much more grateful for all of the little things in life. I don't take things for granted as much. I notice things that I didn't notice before, and I've learned a lot. People who have been through tragic situations in their lives often have a lot of insight to share and a lot of generosity in their heart where they want to give back in some way, and they impact other people's lives. Patients will always remember and be incredibly grateful for treating every moment from the time that they step forward in the hospital to the time that they leave with an element of sacredness to it. And every time that little moment becomes sacred, the care becomes significantly different. It's not so much care, it's something bigger than that.
What really excites me about Mission Hospital is that they're already a fantastic hospital. They're not resting on their laurels and accepting status quo. They're really looking to the future on how they can do more for the community, how they can improve their services, how they can bring in new technologies. If you're not growing and you're not improving, then you're really not doing what the community deserves. And Mission was, I think, looking beyond its immediate community and bringing together other hospitals in the area to form a network of hospitals that can support a larger part of Orange County. There's the new Neuroscience and Spine Institute. My mother had neurological problems after the stroke. That wasn't there then. That is something that can help other people in the future. Now, the Laguna facility is going to be opening up a leading behavioral health and behavioral science center, and I think is going to be taking a bigger role in participating with families before there's an emergency, so that health overall can be improved and the connectivity with the hospital can be stronger.
You look at the expansion of communities with the building of homes and bringing in new families. There's a public structure for schools and for fire stations. But where healthcare is concerned, that has to come from private dollars. And so philanthropy really plays an important part in helping hospitals meet the needs of the community.
I think when someone goes so far out of their way, far beyond expectations to do something so important for anyone, that you immediately feel like you want to reciprocate in some way to help the individuals who helped you, the organization that helped you, and to make sure that the organization has the opportunity to continue to do this for other people.